Welcome to Transform. I'm Mohan Girdardas, the founder and CEO of LeanTaaS. What is driving the perfect storm that has made it so much more challenging for health systems than it has been for the past several decades? Let's talk about a few of them. This is a complex set of issues for sure, but if we were to step back and identify the operational root cause driving most of them, it boils down to a single issue: the real and perceived lack of capacity in the most critical assets of a hospital: operating rooms and inpatient beds. In the past, healthcare could solve the problem by building more hospitals, operating rooms, inpatient units, and ambulatory units, and hiring more staff. Those days are over. Health systems need to find a smarter way of doing more with less. Complex systems have a capacity tipping point. The higher the variability, the earlier the tipping point. Healthcare has incredible variability. Every patient, every provider, every encounter is unique. So the capacity tipping point always comes much, much sooner than any of us would like. Once you cross the tipping point, the entire system becomes unstable. Consider a freeway during rush hour. It is near complete gridlock. That same freeway, outside of rush hour, is smooth and has plenty of excess capacity. Notice the dramatic difference between the two scenarios. Every metric is 4 times worse to 5,000 times worse. This is what I mean when I said the entire system becomes unstable. But you don't have to get all the cars off the freeway to solve the problem. Think of how a bank holiday or a school holiday seems to automatically take care of things. A few intelligent steps can have a huge impact. Health systems live in a state of rush hour for most of the day, every single day. The day begins with a dozen patients boarded in the ED overnight. Throughout the day, the staff scramble to get things done by reprioritizing tests, moving appointments, squeezing in add-ons, trying to get discharges done, and many, many other things. And like Groundhog Day, it happens again the next day. So how do we find the mathematical leverage points that can drive performance? Prior to starting LeanTaaS nearly 15 years ago, I was a senior partner at McKinsey, and I ran the lean manufacturing and lean service operations practice, both in North America and across all of the Asia-Pacific region. Let me share some of what I learned from having led dozens of lean transformation programs on 4 continents over many, many years. Let's go back to the first principles of lean manufacturing that were pioneered a long time ago. It turns out that these principles can be applied to service environments as well, with a few caveats. In manufacturing, it is relatively easy to hide issues related to process flow. If you have enough inventory to cover the shortfalls, you can meet your shipment commitments, even if the factory is not operating efficiently or not operating at all. Just like the water level in the bay, if the water level were to fall, you are forced to deal with the rocks or the underlying manufacturing issues in this case. In a service environment, either the process time or the end-to-end cycle time is like the water level in the bay. As long as you are willing to accept long cycle times, you don't have to address the rocks at the bottom. As soon as you demand higher throughput and lower wait times, you have no choice but to resolve all of the issues represented by those rocks. This is a characteristic of excellence in service operations. Excellent services tend to be fast, and they tend to have a very low error rate. We all remember how long and painful getting a mortgage used to be. They have undergone a 99% reduction in the cycle time over the past several years. This is the single biggest indicator of the operational challenge and opportunities in healthcare. Long wait times are everywhere you look. For example, long lead times to get your first appointment as a new patient, long waiting times to get a bed in an inpatient unit, long wait times to get an elective surgery scheduled, and long wait times to show up to an appointment even though you scheduled it weeks in advance. Maybe that's why they use the word patient to describe the person undergoing medical treatment. So how do you drive towards excellence in service operations? In an environment as complex as healthcare, let me share two concepts. Matching. You have to continuously match the demand signal with the available supply capacity because you cannot inventory anything in a service context. So you start with an accurate prediction of how the demand will arrive over the coming hours, days, and weeks in terms of the volume, the mix, the arrival times. Then you layer in constraint-based optimization for each type of resource and the staff that will be needed. And then you nudge the demand and nudge the supply continuously in order to make the signals match as best as you can. We'll talk more about staffing later, but staff shortages are here to stay. And optimizing the staff has to be done in the context of demand prediction and the supply-demand balance. It is a lot more complex than just time and attendance or payroll. Here's an example of a service that is excellent at matching demand and supply: Uber. Every minute of every day, on every street corner, in every major city of the world, Uber has to match the demand for a ride, which, by the way, you didn't give them more than 10 minutes notice about, with the availability of a car that doesn't belong to them and a driver who doesn't work for them. That is what it takes to pull this off. The second concept is linking. You have to optimize the flow across a set of connected nodes in a health system. Any patient visit is actually a series of independent services that are strung together. There are a few things to follow when you optimize networks like this. You have to optimize the nodes before the edges. Amazon will automate its warehouses before it tries to make drone deliveries. Cisco will optimize its routers before it tries to increase the speed of the networks. Don't allow low-cost nodes to hold up expensive nodes. One additional EVS worker could have a dramatic impact on the turnaround of beds, 10 times the cost of that additional worker. Third, prioritize common nodes on a global basis. If everybody tried to tell imaging which patient they should take next, the system cannot possibly be optimized. Here's an example of someone who does linking extremely well: airlines. Delta Airlines, for example, has 5,000 flights a day across hundreds of airports. Every connecting flight is a linkage problem to be solved. Planes need to be taken out of rotation. Passengers need to be able to make their connecting flight. Crews need to be rotated. This is a class of mathematics called topology optimization or network theory that needs to be applied in healthcare. So this is what we have built: a compelling set of solutions that optimize the capacity of three important assets in a health system: operating rooms, inpatient flow, and infusion chairs. We have proven these concepts by delivering substantial impact in terms of the increase in utilization, the ability to do more infusions, and the ability to discharge patients earlier in the day. Over the past 8 or 9 years, long before the pandemic, we worked closely with over 1,200 hospitals and clinics belonging to nearly 200 different health systems in the US to prove that this can be done in a rapid and scalable manner. We invented the application of sophisticated operational excellence concepts from yield management, route planning, supply chain logistics that are used in airlines and other industries to healthcare. We even wrote a book called Better Healthcare Through Math. It's available on Amazon right next to the other similar cures for insomnia that you would find. Recently, KLAS conducted a new category of capacity management, and we were the only fully rated company with among the highest overall scores that they have ever seen. We are very proud of that accomplishment. Imitation is the highest form of flattery. We are now seeing both small companies and large EHRs claiming to have replicated what we've built. But it isn't that easy. And health system leaders know that. that just because the screens look similar, it doesn't mean that the underlying math has the same level of sophistication or experience from having been proven out in hundreds of health systems over an 8 or 10-year period. Let me show you what it takes and where we are headed. There are 3 pieces to this magic formula. The AI, algorithms based on decades of accumulated experience in lean operations, optimization, simulation, data science, as well as domain knowledge in healthcare. Made stronger by having solved thousands of corner cases in hundreds of hospitals as we work through them. A roadmap that innovates continuously and pushes new capabilities into production every few days rather than waiting for an annual upgrade to happen. The second piece, integrated workflows, automation and optimization methods that are seamlessly embedded into the routine workflows. This takes deep domain knowledge of how exactly schedulers and frontline workers in the ORs and infusion centers actually run their work in order to influence the hundreds of decisions that are being made every day. Change management. You cannot throw software over the wall, run a few training programs, rely on self-configuration and a trouble ticketing system to have real impact on the operational performance of a hospital. We assign teams with deep expertise in perioperative, infusion center operations, etc. They stay with each customer for the entire duration of our relationships. Many of our health system customers have been using one or more of our products for over 8 years, and we still meet with them regularly in order to continuously drive more and more impact. What has it taken? We have raised and deployed over $400 million and built a suite of sophisticated web-based products that use data science, AI, and ML to optimize the utilization of key assets. We have also grown an amazing team of 350 talented people with a diverse set of skills: mathematics, software, lean operations, product management, hospital administration. Our products and teams have delivered enormous impact to our customers. Positive references matter a lot, and our track record has resulted in 200 of the leading health systems in the country putting their trust in us. This creates 2 powerful reinforcing loops. First, by working with such a diverse set of customers, our teams have established long-standing, trust-based partnerships, which is the essence of our transformation as a service. This is embedded in our name. Second, each health system has unique nuances in their assets and their workflows. By working on thousands of these corner cases, our products have become much more sophisticated. They're much more robust, and we're continuously developing new functionality to make them even stronger. Let's talk about some of those. Each of our solutions has a track record of continuous innovation and an ambitious roadmap of the new features and functionality that we will soon make available to all of our customers. We will demonstrate some of those to you in a few minutes. Let me start with the Infusion Center Optimization product. We invented this in July of 2013 with Stanford. Back then, it was 1 infusion center and 50 chairs at Stanford when we figured out the mathematics of optimizing flow. Today, we have 700 infusion centers and nearly 14,000 chairs. Along the way, we've delivered enormous improvements in functionality and capability, and we continue to do so even now. Our second product, Operating Rooms, was invented in 2015, 2016 with the University of Colorado Health, UC Health. Back then, we started out with creating an open marketplace for OR time. And since then, we've had a continuous stream of groundbreaking innovation on that product as well. Our newest product, IQ4 Inpatient Flow, we got started with it in 2017, 2018. And since then, we have delivered 20,000 plus beds of what we're doing. Our ultimate goal is to build sophisticated optimization solutions for each of the important nodes in a health system, and then connect them as appropriate to create the equivalent of air traffic control for individual hospitals, as well as for health systems with large networks of hospitals. This is an enormous opportunity, $200 billion of value annually. or about $30 to $40 million of value per year for an average size hospital. This has materially impacted the financial performance of every health system that works with us. Now, I would like to introduce two of the key leaders in our company, Ashley Walsh, our Chief Revenue Officer, and Tim Vassell, our Head of Engineering. Hey, Ashley. Hey, Tim.
Hey, Mohan. So excited to be here at Transform. That was great.
Tim, I believe you've got some thoughts to share with the audience about our technology stack and where we're headed.
I sure do, Mohan. Here, let me show you. It all begins with data. That's where we drive innovation. First and foremost, we ingest a bunch of data in a cloud-first platform. We use the best across Google, AWS, and Azure, and we have patented technology that cleanses the data. This is a super important step for us because without it, garbage in, garbage out. We're the best in class at taking data, transforming it to data you can trust. And what we do is we have top-notch security as well. SOC 2, SOC 3, HITRUST certified. You will not find a more secure platform for your data on the market. With that secure kernel, we build on top of that to drive a lot of value. There are operational models we put in place. These models are, of course, constraint-based optimization formulations that we've worked on for a decade, as well as capacity protocols that we learn and ingest from hospital systems, and then best practices from the industry. But we don't stop there. On top of that, we have AI technology, both old and new. Some of the earliest things we did were machine learning models that did forecasting and predictions. And now we have some new things to share as well. Generative AI. We'll show you how we're going to use that to make our users way more productive in the platform that we have. And to top it all off, it's not just data and insights, but it's action. So we're providing proactive alerting, we're making prescriptive analytics, and we're automating workflows. And so when you put it all together, what you get is not just a best-in-class user experience with happy users, but high-accuracy AI and a daily release cycle where our innovations go to customers constantly for guaranteed results.
Tim, that was terrific. Thank you for sharing that. Ashley, I believe you've got some exciting news to share with our audience today.
I do. I'm very excited to talk about some of our newest innovations that we're bringing to healthcare. I love that we're a partner that not only is the most secure partner for hospitals today, but also one that is constantly innovating, and bringing these innovations to our customers is our highest priority. So today, I'm going to talk you through a couple of our latest and greatest, and I'm going to actually demo them, and Tim, you're going to help me with that. We're going to talk about how we're really bringing in and incorporating more mobile technology into optimization. We're also going to talk about staffing optimization. Staffing is such a complex issue for all of hospitals today, in both the ambulatory setting, the inpatient setting, as well as many procedural units such as perioperative services. So I'd like to take a minute and demo all of those, and then Tim, I know you're really excited to demo our new generative AI solution. But first, I'm going to introduce my colleague Cam Sexton, who's here with us on Zoom right now. Cam oversees our mobile technologies, and he's going to show you how physicians, nurses, anesthesiologists, vendors, and many more are using our technologies in hospitals right now. Cam, take it away.
Thanks, Ashley. It is unfortunate that in today's day, our providers are still forced to do much of their work through phone calls, faxes, texts, and emails. This is too frustrating for our caregivers and takes away time from patient care. In every other walk of life, we are so familiar with our cell phones providing perfect orchestration, whether it's travel, food delivery, or ordering from Amazon. Why not have the same expectations in healthcare? We are changing that now, and I'm so excited to show you Real-Time View, which takes a mobile-first approach to automate many of the manual and administrative tasks that burden our caregivers and hospitals. We thoughtfully designed this to be incredibly simple to use and integrate seamlessly with normal workflows. Let's just take the perioperative space. Surgeons, nurses, vendors, and anesthesiologists are all running around. They are not stationary at a desk. I'm going to show you how Real-Time View enables up-to-the-second case progress events, ensuring everyone knows the exact status of the schedule wherever they are in seconds. Let's take a look. I'm going to take you through the IQ app. as a surgical coordinator might use the Real-Time View product. So the first screen you're going to see here when you open it is a list of all the hospitals within your system. So let's go into main campus here. And what you're going to see is a live version of today's surgical schedule with the patient progress events that are updated in real time that you'll see in that cell over there on the right. So let's say I want to subscribe to just Dr. Wells's case. So I can tap and hold on that cell, add Dr. Wells to favorite surgeons, and then I tap on the My Doctors tab, and you can see that Dr. Wells's cases have been filtered out from the rest of the schedule. I can go back and also add a third-party medical device vendor to Dr. Wells' case if they're needed. I'll just simply tap on that cell again, and a list of approved medical device vendors will come up. Let's add Ashley Walsh to that case, and then we can back out here and see that Ashley Walsh has now been assigned to that particular case. Ashley can then go in and confirm that she has consulted with her surgeon and dropped off all products needed, with the goal that everyone on the surgical team can see the status of that vendor for that case, ensuring that they're in compliance and have everything needed for that patient. Let's go down here to OR3, Dr. Eric Hartland. If I want to follow an individual case and get updates if that case cancels, move to a different OR, or see the patient progress events for that case, I can simply tap follow on the right there and manually follow that case. And then I can go over to the My Cases tab here on the far right. And now I see Dr. Wells' cases as well as Dr. Hartland's case that we manually followed earlier for all of those events. Down here at the bottom, I can search cases out into the future as well as retroactively into the past. So that's Real-Time View.
Wow, Cam, that is so great. I love seeing how far technology comes every year, especially in healthcare. I'm reminiscing right now about when I first started my journey in healthcare and our cell phones didn't even work in the operating rooms. Tell me, what does it take to actually implement this and get this live up and running? Because I can imagine the work must be a lot getting it rolled out to what could be hundreds of physicians.
That's the beautiful thing about Real-Time View. If you can download an app from the App Store and read a surgery board, you're up and running in 30 seconds with absolutely no training. This is super simple to implement, and caregivers are going to get value from it immediately.
Thank you so much, Cam. I am so excited for what we're doing with Real-Time View and can't wait for all hospitals to have that. Okay, now I want to transition into demoing some of our other latest and greatest technologies that we're deploying across hospitals today. And the first one I'm going to talk about touches a very challenging subject, and that's staffing optimization. Staffing optimization is so challenging throughout every unit of the hospital. Let's take a look. The variability in capacity throughout the health system makes staff deployment so challenging. That's why we're so excited to review the staff optimization capabilities that LeanTOS offers across all of our products. Using AI and workflow automation, we help health systems streamline their most time-consuming use cases, proactive staff planning, nurse allocation before and during each shift, assigning nurses to patients, and real-time collaboration across team members. Let's take a few minutes to talk about each use case. Like other features within IQ, the system monitors operations and notifies you when potential issues are detected, prompting you to take action via text message. From this text message, you can click directly into the platform to review it. In this example, we're looking at IQ for infusion centers. The tool offers insights into how your nursing schedules compare to your appointment schedules and how you can proactively manage potential issues. You can see IQ's recommendations for each day to staff up or release staff to other units if needed. These are based on your specific target staffing ratios or acuity per nurse goals. You'll also see how likely you are to run into issues during a particular hour of the day. Each day you see a section with recommended actions, such as managing your nurse shifts by adding or removing nurses for a particular day, shifting appointments to better level load and balance your day. Next, let's dive into planning for the upcoming shift. In this example, we're looking at IQ for operating rooms. With predictions of upcoming demand and the surgical schedule above, staffing managers can more effectively review the needs. They have instant visibility into available staff by hour, by role, and where they're over or understaffed. Clicking into a row opens up the schedule, where they can see who's available at what time, and they can view their case history experience. Changes to the posted staff schedule are automatically kept up to date by integrating with your staff scheduling system. They can also see what service lines each staff member has the most experience with based on what's scheduled for that day. From here, they can confirm whether they have experience with those procedures or surgeons, or with access to each staff member's full case history, which is automatically updated each day from the EHR. With information readily available, staffing managers can make decisions quickly to maximize the staff they have. They can adjust shift times, float people from another location, or plan to have RNs cover scrub variances. In this example, I'm updating the staff member's shift time so she can cover the afternoon where we need help, and the tool will automatically send a notification to that staffing member. Now that we staff where we need them, we need to assign patients to the staff. IQ intelligently matches patients with the right nurses in real time, allowing you to easily manage patient flow and balance nursing workload. Considering factors like maximum acuity at any point in time, number of concurrent patients, or time since the last patient was started. Whether your nurses self-assign or charge nurses make assignments as patients arrive, the patient assignment tool has you covered. By optimizing patient-nurse assignments dynamically, this tool ensures proper staffing levels, balanced workloads, and an overall elevated experience for both the patients and providers. A common thread that runs throughout all these examples is collaboration. IQ streamlines collaboration and eliminates the hours spent rounding, making phone calls, and sending emails and text messages. In this example, we're going to show you how IQ for inpatient flow streamlines communication between the staffing office and frontline staff to take on an extra shift. The process starts with the staffing office sending a message directly through the platform to a nurse, asking if he or she can take on an extra shift. When the nurse replies to the text message, it goes right back into the platform for the staffing office to view. Because this nurse has accepted the extra shift, the staffing office will allocate the nurse an IQ, which automatically updates in the workforce management system as well. Within an hour of the shift, the nurse will receive an automated text notification with the details of their assignment. These are just a sample of how IQ can help health systems optimize staffing, empowering proactive staffing decisions, optimizing staff allocation, streamlining communication to ensure optimal patient coverage. So that's real-time view and all of the optimization we're doing in staffing. Now, Tim, I know you've been waiting. We're so excited for you to demonstrate what we're doing with generative AI.
We are very excited to announce IQ Autopilot, the very first generative AI solution for hospital operations. Now, we've teased this a little bit from our last Transform event, where we've described 3 modes of operation: a lean forward, a lean back, and in-the-moment problem solving. So these are all great modes. Today I'm going to focus explicitly on the lean forward and show you what you can do with asking questions right in our products. Okay, here we go. Engaging with AskIQ is as easy as clicking the AskIQ button available throughout the operating room's product. Once you're here, you have the ability to ask questions like, tell me about my block utilization, or what is my block utilization? A very common question, as Ashley knows well. So when you ask IQ this question, you're going to get the results, but they're not going to be in the chat. They're going to be right in the product. So AskIQ is a way to teach you how to use the battle-tested product that we've had in service for quite a while. So the innovation is really having a customer service expert, a transformational expert by your side in the product 24/7 to guide you through it. So I didn't have to know where to click on to get this metric. It just guided me right there. And further, if I want to do more advanced things with reporting, like say, compare this to last quarter and group by service line. There's a way as an expert I can click around and figure that out, but I don't have to be an expert. I can just talk English and AskIQ will figure it out for me. So this is great. I've got some analysis here. Now, if I want to go further, say I want to remove GI and maybe one of my regions. I'll say just remove GI in the LA region. I can, again, do that without really thinking about where to click. I can craft my graph appropriately, and you'll notice that the GI service has been deselected, the LA region gone. And it even matches without getting an exact name. Switching metrics, navigating throughout the app, just as easy. We can talk about total utilization, one of the newer metrics we have at play here. And one of the things we pride ourselves on with AskIQ is we are not hallucinating this data. Because it's driving the battle-tested actual product with cleansed data, we know the results are correct, and we stand behind them. So here it is. Here's the chart. And if I want to even modify this further, like let's say nix that comparison to prior date, we can do that, and we're off to the races. But the fun is not just for the operating room's product. We've expanded AskIQ across the product suite. So let me also show you IQ in action in our inpatient product. All right, here we are in the inpatient application. Again, AskIQ readily available. On this side, we've souped it up a little bit. You're going to see something new here, a microphone. So it's very easy for me to click a button and just talk to AskIQ and tell AskIQ what I need. Hey, how about a staffing plan for May 3rd on the downtown campus? AskIQ is going to parse my phrase there and provide me with exactly what I asked for. So you can see it's smart enough to drive the UI, to select filters for me, downtown campus pre-selected, the right date, and there's my staffing plan. All right, how about this? Show me my capacity protocol pages. This looks like the one I want. And when I'm here, you'll see all the different hospitals in my health system and their different statuses for diversion, pre-divert, and so on. Let's ask some questions here. Hey, I have a med-surg patient needing gastrointestinal care. Where should I place them? Wellesley Hospital, excellent choice. Wellesley is actually one of the hospitals that does have GI as a supported service line, and it's on standard operating procedure. And I also want to highlight that not only can it summarize a page and answer questions about it, but it can understand clinical abbreviations too. So if I want to find a page in the app with DOs, discharge orders, we can see that it's smart enough to find pages matching that concept. Here's a key report, my discharge work list. Let's ask about these patients. All right, so here we are looking at a bunch of patients ready for discharge, and we can ask IQ questions about the page. One question might be, what are the most common discharge barriers? And AskIQ will tell us the answer. That's pretty convenient. How about this? Explain EDD best practices. Now here's something that's not on the page specifically. Instead, we're pulling from our own best practice workbenches and giving that information to you as a user. Finally, I want to showcase one last thing with AskIQ. Take me to my capacity hub. This is going to be one of the dashboards that we have that will show a bunch of metrics, and it's one of the places where AskIQ really shines. There's a ton going on here on this tab, the KPI Performance System Scorecard. We can, of course, ask questions like, can you summarize this for me? That's easy enough, I'm sure. It'll pull all the data from the table and synthesize some thoughts and recommendations. That's a lot. Give me a key takeaway. Okay, so patient throughput, especially disposition to departure. Looking at the data, I'd say that makes sense, but you can also have fun with this too. So if you want to say, give me a key takeaway in limerick form, it might be able to do that too. So that's the power of Ask IQ. I think you're going to enjoy it as much as we enjoyed building it for you.
That is incredible. I am so excited about these innovations and the advancements of Ask IQ. I can't wait for all of our partners to have not only Ask IQ, Autopilot, but also real-time view and all the staffing optimization that we're doing in the various units. So it's my pleasure to announce that for all of our existing partners, this can be available for you today at no additional cost. So we can't wait to keep innovating with all of you, and we want you to keep pushing us to do more in healthcare to take your operations to the next level.
Thanks, Tim. Thanks, Ashley. That was terrific. I'm excited about all of the new innovations and can't wait to have it in the hands of our customers. Again, welcome to Transform. I encourage you to engage fully and participate as much as you can. Ask us questions along the way. Next, I'd like to talk with Steve Hess, the CIO of UC Health, so he can share his perspectives on what it takes to drive operational excellence in this environment. Thank you.